The fundamental aspects of fractures in sport injury management. Sports injuries are commonly caused by overuse, direct impact, or the application of force that is greater than the body part can structurally withstand. The meaning of a fracture sports related. A fracture is a partial or complete break in the bone. There are many different types of fractures. Closed, simple fracture, the broken bone has not pierced the skin. Open compound fracture, the broken bone juts out through the skin or a wound and leads to the fractured site. A stable fracture, the broken ends of the bone line up and are barely out of place. Basic fractures relating to sport. Fractures are common in contact sport such as basketball, rugby, and football. The most commonly fractured bones in contact sports are the hands, wrist, collarbone, ankle, feet, and the long bones of the lower extremities. Stress fractures. A stress fracture is a very small fine break in the bone as a result of continuous overuse. Stress fractures often occur in the foot after training for basketball, running, and other sports, while stress fractures can occur in many bones that are subjected to repetitive activities. What is an acute fracture? An acute fracture is a break in the bone that occurs from either a quick one time injury. How these fractures occur. Stress fractures. Stress fractures are usually overused injuries. They happen when physical activities put too much pressure on a bone and it doesn't have enough time to recover. An acute fracture. Acute fractures, bone fracture, is the medical definition for a broken bone. Fractures are usually caused by traumas like falls, car accidents, or sports injuries. What are the signs and symptoms of these fractures? Stress fractures. At first, you might barely notice the pain associated with a stress fracture, but it tends to worsen within time. The tenderness usually starts at a specific spot and decreases during rest. You might have swelling and bruising around the painful area. An acute fracture. There is sudden pain at time of the incident, severe pain in the injured area that worsens when moved or pressure is applied. The inability to bear weight on the limb, swelling or bruising, numbness and tingling, obvious deformity of the injured area, loss of function or difficulty using the limb, broken skin with bone protruding through. Basic treatment. Treatment. Treatment depends on the type and severity of the fracture and may include pain relievers. Apply injury management protocol, price, protect, rest, ice, compression, and elevation. Maneuvers or procedures to move the fractured bone fragments back into their normal position, reduction. Immobilization of the injured part, for example, with a cast. All these treatments should be practiced by a trained professional. Healing. Healing mostly takes 6 to 8 weeks, but varies tremendously from bone to bone and in each person. The immediate action required when an acute fracture happens during sports activities. Keep the injured area from moving. Do not try to realign the bone or to push the bone that is sticking out back in. If you have been trained in how to splint and medical help isn't available right away, apply a splint to the area above and below the fractured site. Padding the splint can help reduce pain. The immediate action required when an acute fracture happens during sports activities. Keep the injured area from moving. Do not try and realign the bone or push a bone that is sticking out back in. If you've been trained in how to splint and medical help isn't available right away, apply a splint to the area above and below the fractured site. Padding the splint can help reduce pain.